Imagine this. You reach 65 years old and you just opened your mailbox to find your Medicare card. It feels exciting at first, but then reality hits. You have a big decision to make. Do you stick with original Medicare and add a Medigap plan, or do you switch to Medicare Advantage? If you're feeling overwhelmed, you're not alone. Thousands of seniors face this same choice every year, and it's one of the most important healthcare decisions you'll ever make. The wrong choice could cost you thousands of dollars or limit access to the doctors you trust. But here's the good news. By the end of this video, you'll clearly understand which option fits your health needs, lifestyle, and budget without all the confusing insurance jargon. Let's start with the basics. Original Medicare covers hospital stays and medical services, but it doesn't cover everything. You still pay deductibles, co-insurance, and there's no limit on how much you might spend in a year. That's where Medicare Advantage and Medigap come in. Medicare Advantage replaces original Medicare with a private insurance plan that manages your benefits, while Medigap works alongside original Medicare to help pay for the costs it doesn't cover. One option is more structured and managed, while the other offers more freedom and predictability. Now, let's talk about money, because this is usually the biggest concern. Medicare Advantage plans often have very low monthly premiums, sometimes even $0, which makes them look like a great deal. But you'll usually pay copays, co-insurance, and deductibles each time you use healthcare services, and those costs can add up quickly if you get sick. Medigap plans, on the other hand, have higher monthly premiums, but when you go to the doctor or hospital, your costs are usually very small and predictable. So the real question is this: would you rather pay less every month and more when you need care, or pay more each month and worry less when something happens? Another major difference is doctor choice. Medicare Advantage plans use provider networks, which means you're limited to certain doctors and hospitals. If your doctor isn't in the network, you may pay much more or nothing may be covered at all. Medigap works with original Medicare, which means you can see almost any doctor or go to any hospital in the US that accepts Medicare. No referrals, no network restrictions. If you have doctors you trust and want to keep, this freedom can be a huge advantage. Travel coverage is another important factor. Most Medicare Advantage plans only work in a specific geographic area, so while emergencies are covered when you travel, routine care usually isn't. Medigap plans generally work anywhere in the United States where Medicare is accepted, and some plans even provide limited coverage for medical emergencies abroad. If you travel often or spend part of the year in another state, this can make a big difference in your decision. Now let's talk about out-of-pocket protection. Medicare Advantage plans are required to have a yearly out-of-pocket maximum, which means their SA cap on how much you pay for covered services in a year. That can offer peace of mind. Original Medicare doesn't have a cap, but when you add Medigap, most of those gaps are filled, making your healthcare costs very predictable. You may not have a formal maximum, but you also won't be surprised by big medical bills. Prescription drug coverage is also different. Most Medicare Advantage plans include drug coverage, which is convenient because everything is bundled into one plan. Medigap plans don't include drug coverage, so you'll need to buy a separate Part D plan, but this also gives you the freedom to choose the drug plan that best fits your medications. So how do you choose? If you're generally healthy, don't travel much, and want to keep monthly costs low, Medicare Advantage might be a good fit. If you have ongoing health conditions, want to see any doctor without worrying about networks or travel frequently, Medigap may be the better choice. It also offers more long-term flexibility, especially because switching from Medicare Advantage to Medigap later can be difficult if your health changes. At the end of the day, there's no one-size-fits-all answer. The best choice depends on your budget, your health needs, your travel plans, and how much freedom you want in choosing your care. Now, I want to hear from you which plan sounds like it would work better for your lifestyle, and why. Are you focused on keeping monthly costs low, or do you value flexibility and predictable expenses? Drop your thoughts in the comments below, and if this video helped you, give it a thumbs up and subscribe for more clear, simple Medicare guidance.